Good afternoon. I'm David Harris. I'm President and CEO of the Urban Strategies Council in Oakland, California. It's my honor this afternoon to present on a topic that is very important to our work and our mission, and that is addressing public safety and justice reinvestment in communities of color that have been disproportionately and in many cases negatively impacted by police. And so the topic of today's conversation is developing non-police alternative programs for nonviolent, non-health emergency 911 calls. We know that in many communities, many of the calls for 911 do not necessarily require someone with a gun and a badge to show up. Many times the unintended consequences are loss of life or harm to both the individual who the call was made on and trauma for the emergency responders. We at Urban Strategies Council have been working on developing non-police response programs for municipalities that are interested in transforming their emergency response system for these non-violent and non-health emergency calls. To put it in context, there are, in one city we worked with, over 90,000 calls into their 911 system annually, and roughly 10% of those calls involve clearly situations that a gun is not present, there's no threat to the life of the person, or there's it's not a health issue that requires advanced medical support and response. So my presentation today, as far as the overview, I'm going to share a little bit with you about Urban Strategies Council. I'm going to go over the context of two cities that we've worked in, both Oakland and Antioch, California. Our model for the development activities that have to occur to build out a non-response program, and what are the outcomes from the work we did, including the lessons learned. First, on Urban Strategies Council. We're a 35-year-old Oakland-based national nonprofit, and our statement of impact is twofold. One, we want to increase the knowledge, capacity, and strength of community leaders and organizations that are working to dismantle racial and systemic barriers to opportunity. We have 4 areas of core competency that we work in. We're known for our data and research, which is research at a university level quality, but also done from a community-based perspective and foundation. Our second area of competence is in collaboration building and collective impact. We lead a number of what we call community tables that bring together multiple organizations working towards a common goal. The examples of some of these tables include the Justice Reinvestment Coalition of Alameda County, which focuses on reinvesting the funds that are secured by the criminal justice reforms going on in California, having that money reinvested in communities. We also lead the Opportunity Youth Initiative Collaborative in Oakland, as well as the Alliance for Boys and Men of Color in Oakland and Alameda County. Our third competency area is in leadership development, specifically focusing on young people and helping them build the skills and capacity that they need to be able to address the problems that are going to be ones they have to own in the future. And lastly is policy, innovation, and advocacy. That's where we really bring together the data, the partnerships we've built, and the leaders we've helped develop to actually advocate for and achieve changes in public policy. This area of work for us would be considered an area of policy innovation, as over the last 2 to 3 years, the whole issue of alternative response programs has really accelerated both locally in our area, the Bay Area region, as well as nationally and internationally. So first, Oakland, California, and our work there. Just to give you some context, Oakland is a city of 425,000 people, pretty diverse city that has had long and fraught relationships between Oakland's Black population and the police. Well, many of you may know that Oakland was the founding home of the Black Panther Party, and the issues of police community relations in Oakland, and clearly the conflict in police community relations goes back decades. However, specifically this community response alternative program was spurred by not just the unintended police shootings with individuals who were unarmed, but also fueled by the growth of the unhoused community in Oakland. It was to address the needs of the unhoused community. When speaking with many of them, they really talked about the challenges they had dealing with the police, and specifically efforts to break up encampments, to deal with calls that had been made on them for being in someone else's neighborhood and so forth. We worked with the Coalition for Police Accountability, which is a local advocacy organization where they sponsored a community forum which brought down representatives from the Cahoots program model from Eugene, Oregon. And based on the presentation and the response by local policymakers expressing interest in a similar model, the Oakland City Council funded Urban Strategies to develop a program model for Oakland that was based on Cahoots. This was in mid-2018 mid-2019 that the City Council provided the funding. We began the work in early 2000, almost just as soon as the pandemic was beginning. And we did that work by bringing together a coalition of organizations from around the city that represented very diverse interests, from organizations involved in police reform to organizations representing different communities like the disabled community or the unhoused community. We brought together organizations specifically located in neighborhoods that were most impacted by the 911 system. And we also had other legal organizations and good government organizations involved. But it was a group of over 25 that began meeting to help us in the design of the program. We divided that collaborative into 3 working groups. One that was focused on analyzing the current 911 system, the flow, how calls came in, how they were routed, where they went to, what were the types of calls, the response time, the topics they dealt with, was one of the working groups. The other working group looked at best practices in terms of models that were not just local or regional, statewide, but also national and even international, to try to identify the key practices and successful alternative response programs. And then the third working group was responsible for community engagement. This working group was charged with conducting community-based participatory research by actually hiring individuals who had been impacted by the 911 system to go out into the community and survey other people about what their visions and aspirations were for the 911 system if it did not involve police. We specifically targeted neighborhoods that were most impacted by 911 calls, which were largely in Black and Brown communities. And this work was done alongside an effort in Oakland to look at reinventing policing based on Oakland's rather fraught history of police relations between communities of color and the Oakland Police Department. Then, after we completed the work in Oakland, we also did a similar project in Antioch, California, which is a smaller city of about 114,000. They had a particular goal that was concerned with individuals who had been in mental health crisis. Antioch had a situation back in 2020 where a young man who was having a mental health crisis was shot and killed by police in a situation where he was unarmed also, and it was a very negative unintended consequence of the police response. Whereas in Oakland, there was a focus on targeted neighborhoods. In Antioch, it was intended to be a citywide system and also designed to get input from residents across the city, not just a subgroup of residents. But the city council also was concerned about the growth and particular needs of the immigrant community in Antioch, as well as similar to Oakland, a growth in the unhoused number of unhoused residents, and also this planning effort had to be aligned with similar work that was being done at the county level, where the county was looking at developing an alternative response system pilot initiative that they would test in a number of the cities in the county. Antioch was interested in designing their project so that possibly it could be included in the county pilot program. In each of these cases, in both Oakland and Antioch, we came up with a 5-step methodology or process for how we would advise the city on the development of the program. Those 5 development activities include data and research, community outreach and engagement, systems alignment, building key stakeholder support, and development of the model, the actual model, and implementation planning. Each of these steps were very important, specifically given the nature that not every place is the same. And even though broadly these models are all based on one premise, that it would be a non-police response for these low-level calls, the way in which that response was designed and implemented could potentially be different based on the local context, the way local systems are organized, and who the key players are that need to be involved in implementation. What we found after our first experience in Oakland was that many times when people start off with the program development, given where we're at in this day and age, people will always start with, oh, we need something like Cahoots, or look at what they're doing in Eugene and let's sort of copy that model. Well, the Cahoots program, which has successfully operated for over 30 years, has unique aspects to the way that's organized. That's also based on the local support that they get from communities, as well as some of the requirements legally that the state places on response programs, as well as the continuous improvement and change that they've done based on their experience. And so while these other models are important as a foundation starting point, not every program is going to look the same. And there is another assumption that we found that both cities started with in Oakland and Antioch, that we need this response system for mental health related calls, that it was generally tied to someone who might be in mental health crisis. And as we dig deeper into each of these areas, we learn that there are a broad diversity of calls that require some analysis and even triage in deciding which ones you're going to have as a response for the alternative system. So let me talk a little bit about each of these activities specifically, and let me define what each of them are. The data and research includes both quantitative and qualitative analysis. It's not only looking at the calls, what type of calls come in, when they come in, what the call is for, and where it's at, the response time it took, as well as the resolution status. In terms of quantitative information, most of that is data that comes from law enforcement, and it also represents some of the most difficult data to get because law enforcement is not necessarily in the habit of opening its information to the public. And it's usually something that in both cases we've had to work hard to get from the local police departments. The research that we've done also is based on the qualitative analysis, and that includes surveying residents, doing focus groups, listening to the stories of those who have been most impacted. But it's a broad effort to go out and try to understand from the view of those most impacted how this system has either supported or harmed them. When we talk about community outreach and engagement, we're really looking at the fact that most people are hardwired that in an emergency, they want to call 911. However, there are alternative numbers set up, and we specifically go out and talk to residents about their desire for an alternative phone number, given the distrust that exists between many of these communities and law enforcement. We go deeper into looking at what community resources and assets exist that can help support any type of alternative response system. And we're also working to increase community awareness that if there is an alternative response system that's developed, it's really going to need some community oversight as well as community awareness so that the service is actually used when it's intended for. For us, systems alignment is a critical development activity because in many cases we're talking about changes in policies and practices that cut across city and county jurisdictions, as well as across different systems like the law enforcement system, the healthcare system, and others. And so emergency response is generally not an activity or a government responsibility that's solely in the realm of one department or one agency. It's important to understand the multiple systems that need to be engaged and how they need to be aligned towards a common goal. Building key stakeholder support. And what we mean by that is that these ideas, the development of an alternative response system is something that is invariably going to have political support. It's going to have to be funded, and it's going to have to be viewed as something legitimate from the eyes of community residents. And that type of support doesn't automatically happen. You have to build it. And that happens through having very targeted conversations with influencers in both the public sector and in the community who can help influence the way others will support the initiative. And then lastly, the nuts and bolts of the developing the model and implementation planning have some very specific aspects to it that I'll discuss shortly. But going back to the first two, the issue of data research and community engagement, I just wanted to dig a little deeper on these two because that's where a bulk of the work is done. As I mentioned, one of the first things is looking at best practices and program models. Since the murder of George Floyd and how this whole area of alternative response programs has just taken off in attention and in the desire to come up with new models. There's been a great deal of innovation that has been going on and is currently going on in communities across the nation, but not just in the United States and Canada. Also, there's a proliferation and growth of these programs, and there is quite a bit to learn from what different people are doing and testing. It's an interesting area to be following right now because of all the work that's being done in different places. With our data and research, we also perfected something we call a data needs assessment, a DNA. And that is where I mentioned about us analyzing the calls of what is being, what kind of calls are going into the 911 system, et cetera. But the DNA specifically looks at where the gaps and where the areas in data that need to be strengthened in order to better plan and develop an alternative program model. So, for example, most law enforcement departments do not disaggregate their data by race. And it's a very important task that needs to be done to really get an accurate assessment of who is the community being most impacted by the 911 system. There are gaps in the way data is recorded because there is no standard, there's no standard identifier across different police departments for the kind of calls that are being responded to. What's called label sleeping in your car in one police department might be labeled something else in another. And so we look at what the the disparities are the disorganization and how calls are being organized, so we can also understand the gaps there. We do focus groups with individuals at all levels in the community across all of the different type of racial, ethnic groups, as well as in different neighborhoods. And I mentioned about the key stakeholder interviews, why it's important to do that to build support. And in both Oakland and Antioch, we did resident surveys. In Oakland, those surveys were all done face-to-face by people who have been impacted by 911, with people in communities which had the greatest 911 calls. And those were done primarily in person. And we had over 100 surveys that were done. And in this case, if we notice that there's a particular segment of the community that we don't have reflected in the survey, we'll go out. We'll go out and find people from that community segment so that they can be included. In Antioch, we had a combined online as well as in-person survey. By the time we did Antioch in 2021, the pandemic was at one of its highest points. So we used really an online outreach process. And we had over 500 residents complete surveys. Again, based on who responded to the online surveys and who we didn't get, it helped inform us as to who we then had to go out and try to interview or survey in person because they weren't as represented in the online surveys. And so that gives an overview of the type of data and research. When we talk about model development and implementation planning, here's where we really get to the nuts and bolts of designing the program. In each case, we looked at and identified topics and resources to train staff both internally, as in the case of the police department or dispatch, as well as externally in training community organizations and leaders on how they could access the alternative response system. Logistics and administrative planning. There are questions as far as where would an alternative response team be located? Who do they work for? In the case of Oakland, the city initially had desires for an alternative response system that would be managed and implemented by a nonprofit organization. However, as we went out and did interviews and looked at our local capacity, we found that there was a good amount of support in communities of color specifically that were most impacted for the fire department to have an increased role in the 911 response system. Generally speaking, there was a lot of a lack of faith and a lack of support and increased police presence in their communities, but they were okay with the fire department. And so in Oakland, uh, uh, the decision was made to place this alternative response model, the macro program, to place it in the fire department. And doing so required an extra layer of administrative planning because now the folks who worked on these response teams were going to be city employees. There had to be a specific civil service classification developed for these new positions. There had to be negotiations with the main collective bargaining units for the city in terms of whether these positions would be union or not, or represented by the union. And so they're depending on how the program is structured, it leads to a number of logistics and administrative issues, particularly around personnel and human resources. Also, in developing the model, there are the strength of any alternative response program is directly related to its ability to make referrals for individuals who are in crisis to provide follow-up support to address the underlying issue that caused the 911 call in the first place. The 911 response is intended to be an immediate resolution response for a situation that affects public safety. That doesn't necessarily mean that whatever the issue was underlying that caused it, that caused the man to be standing in the middle of the street screaming and taking his clothes off, is necessarily solved by a 911 response. In fact, if the outcome of the 911 response, whether it's a police response or an alternative response, leads to individuals becoming incarcerated or involuntarily committed for mental health, then those are considered negative outcomes. And so there is a need to build collaboration with networks of support programs, and generally provided by the nonprofit or the sector or health organizations, where you can be able to refer someone who is in crisis and where they could have follow-up support for addressing it. Building that network, developing the memorandums of understanding, developing the referral protocols, and also the agreements around financing. All of those things have to be done as part of the model development under this whole area of building collaboration. Of course, there's laying out the program budget, identifying funding sources. Both funding sources may be private or public. They may be local, they may be state. In the case of Oakland, Oakland budgeted $1.85 million for its alternative response program. However, by placing it in the fire department, given the benefits and salaries there, the city needed additional funding and got an allocation from a state legislator of an additional $10 million for the effort. In the city of Antioch, Antioch expects to implement a model, a pilot program model that will cost in the range of $1.75 to $2 million to $2.5 million. They've decided to use some of their American Rescue Act funds to help initially start it, as well as go out and seek other potential funding sources. Additionally, when developing the model, you have to also come up with an evaluation plan and system, as well as a timetable for implementation. Now, I've broadly talked about what alternative response programs are and look like, but like I said, they can come out very differently in different places. In Oakland, the alternative response team will consist of 3 people: an emergency medical technician, a community intervention specialist, someone who knows the community and knows probably many of the individuals who are subject of the 911 calls. It certainly knows the resources and communities that you could use for referral networks and purposes. And there is also a clinical support person that provides a higher technical level of clinical support, particularly for mental health and other health-related calls that come in. In Antioch, the model is just a 2-person team, a community response specialist, as well as an emergency medical technician. In both communities, we, as part of our planning, so this is an opportunity to advocate for 2 additional goals. One was that some of these jobs, particularly the community intervention specialists or community resource specialists and the EMTs, were ideal opportunities for community residents to be able to get those jobs and certainly get a higher level of employment that many of them may currently have. We saw this as a workforce development opportunity, particularly for people themselves who had been impacted by either the law enforcement or the emergency response systems, and based on their experience, had a unique perspective in being able to help implement something that would be more transformative. Secondly, we had the opportunity to advocate for living wage positions. These jobs, whether in some places they're called violence interrupters or credible messengers, are generally devalued. They're paid $40,000, $50,000 a year, and they go primarily to community residents. But especially in a place like the Bay Area, you cannot be able to, $50,000 a year is not a sustainable, is not a salary that's a family sustainability wage in our region. And so in both cases, we advocated for salaries that wouldn't be that far off from some of the people that our alternative responders would have to work with, like dispatch or community service officers in the police department or EMTs in the fire department. So that was a major part of our implementation planning, and we were able to influence both who was included in the pool for employment selection, as well as the starting salaries in both cities. And so finally, the outcomes, and this is an example when I talked about data of the type of the diversity and type of calls that led us to realize that this goes beyond just mental health related calls. In the city of Antioch, they sort all 911 calls, giving them a priority level between 1 and 5. Everything 1 and 2 involve a weapon, involve a threat to public safety, and can't be sent to an alternative system. Level 3 calls, and these calls are coded at the discretion of dispatchers, may be a little bit in the gray area. Some of them may involve not a gun, but another type of weapon. It might be a domestic violence call. But level 4 and 5 calls have no weapons. They're generally the type of calls that involve wellness checks, things like that, that literally can be handled by someone other than the police. And so this gives you an example of the type of calls that in Antioch that are level 4 and 5, everything from being drunk in public, all the way to, as I mentioned, sleeping in your vehicle. All of these things could be handled by a non-police response system. And so, as I mentioned, in terms of the outcomes in Oakland, macro, the Mobile Assistance Community Responders of Oakland, it was decided that that would be implemented in the fire department with the city's nearly $2 million commitment and the $10 million they received from the state. It's taken a longer time to get started because of the fact that it's actually being institutionalized in the city, which I think is a very good outcome, because that ensures that the city sees this as their fundamental responsibility, and by putting it in the fire department, has a greater chance for long-term sustainability. And they're currently in the process of recruiting startup staff. They've hired a coordinator who is building on the recommendations that we've made to develop the program and handle the coordination with the county as well as other city departments. So they're up and running and will more than likely be on the ground by June of this year. In Antioch, they chose a different direction. They've decided they will contract the response program out to a community-based vendor. They will issue an RFP or an RFQ and more likely in February of this year to identify the vendor. Like I said, they put aside some of their own American Rescue Plan funding for startup. That will probably happen late summer, early fall. Overall, from this experience, we see ourselves and at Urban Strategies as an intermediary to help, as I said, build the knowledge, the capacity, and the strength of communities to dismantle these barriers, both systemic and practice to opportunity. But we base all our work fundamentally on data. What we learn from the experiences primarily of those who are most impacted by the problems that we're trying to solve. And this is an area where, especially in working with systems that have generally had, like I said, difficult relationships, particularly with communities of color, the only way in many cases to shift their mindset and perspective is through the use of data to show them how either their current activities are harming communities or are inefficient. And what we've learned is that police officers themselves do not think that every call they respond to has to be handled by an officer with a badge and gun. But we get that message and point across through the use of data. And I can't stress enough how digging into community-based data is key. And then our sweet sauce in all of this has been our ability to engage communities in the actual code design of the process to get their feedback, to work with communities, like I said, to understand their visions and aspirations for an alternative system. But even more so, instead of always approaching communities from a deficit perspective, also trying to understand the assets that exist in communities, because ideally the ultimate vision is that while it's great to even have an alternative response program, it would be even better if many of these conflicts or these situations could be resolved at a community level without even having to engage systems like law enforcement or emergency response. And that's a vision that we have heard from the individuals we've worked with in both communities. So with that, I'll say thank you and stay safe out there and stay well.